Hi, everyone. Welcome to this presentation on therapeutic communications in EMS. Today, we'll explore how effective communication can make a real difference in patient care. As EMS professionals, you're often meeting patients on one of the worst days of their lives. The way you speak and listen to them, your therapeutic communication, can help calm a patient, build trust, and gather critical information. In this lecture series, we will discuss what therapeutic communication means for EMS professionals and why it's so important. We'll look at techniques for building rapport with patients, how to show empathy and understanding, and ways to handle challenging situations like when a patient is angry, scared, or unable to focus. We'll also talk about being aware of nonverbal cues and cultural differences. By the end of this lecture, you should have a better understanding of how to communicate in a caring and effective way with your patients and their families. Let's get started. As an EMS professional responding to an emergency, you are often walking into a very private moment in a person's life. EMS professionals often see people at their most vulnerable. It's crucial to remember that being allowed into their home and life is a privilege. You should see every invitation into a home as a personal honor. If you approach each patient encounter with that mindset, you will naturally treat patients with humility and respect. Practically speaking, this means you should always do a few things. You should introduce yourself and address the patient respectfully. For example, greet them by name or ask what name they prefer to go by, and explain that you're there to help. First impressions matter. Be mindful that you are in someone's personal space. Treat the environment with respect. Don't move or handle personal belongings unless necessary for care. And ask permission when you need to do something like opening a cabinet for supplies. Remember, you're a guest in their home during a crisis. Stay non judgmental no matter the situation. You may walk into a messy house or an unusual scenario, but put any personal judgments aside. Focus on the patient without showing shock or disapproval about their living conditions or what led to the emergency, even if them or the situation they are in is drastically different from what you have known. We are not there to pass judgment, but to help. By showing respect from the first moment, you begin to build trust with the patient and family. They realize that even though you're a stranger, you are considerate and professional. Simple gestures like asking, "Is it okay if I put my bag down here?" or speaking in a calm, polite tone show that you recognize you're entering their space. Cultural competence is also important. Be aware that different families may have different customs or norms, for instance, how they address elders or norms about personal space and modesty. Being sensitive to those will further demonstrate your respect. Establishing this trust and respect right away creates a strong foundation for effective communication throughout the call. A key part of therapeutic communication is building a good rapport with your patient. Rapport is just a fancy way of saying a relationship of understanding and trust. Good rapport is essential for obtaining good medical information from a patient. If a patient feels comfortable with you, they're much more likely to share honest, complete information about what happened, what they're feeling, and their medical history. For example, if a patient is embarrassed about their symptoms, perhaps they think it's a silly reason to call 911, a warm, non judgmental approach can encourage them to open up. They realize you're not judging them, and that helps them talk. Sometimes a patient may be reluctant to answer personal questions. They might wonder why you're asking certain things, especially if questions feel private, like medical history, medications, or personal habits. In these cases, it's important to gently explain why you need that information. For instance, if you ask about their medical history or medications and they hesitate, you could say, "I know these questions are personal, but I ask everyone because it helps me understand what might be going on and how I can help you better." When patients understand the reason behind your questions, they're more likely to cooperate. This approach shows respect for their privacy while still emphasizing that the information is important for their care and safety. Another challenge is when a patient has trouble focusing on your questions. Maybe they are distracted by the chaos at the scene, overwhelmed by pain, or confused due to their condition. In a noisy or crowded environment, a patient might not be able to concentrate on what you're asking. In such cases, it can help to move to a quieter setting. For example, if you're in a room full of worried family members all talking at once, you might say, "Let's step over here so I can hear you better," and move the patient a little away from the commotion. If the situation allows, moving the patient to the ambulance can create a controlled, calm environment. By safely moving them to the ambulance or a quieter area, you minimize distractions. In that calmer space, the patient can focus on you and your questions. This often helps them gather their thoughts and can reduce anxiety. They may feel more secure in private, which makes it easier for them to share information about what's wrong. Another essential aspect of communication, and really of patient care, is respecting a patient's privacy and modesty. In this context, modesty means being careful about a patient's exposure, physical exposure of their body, and safeguarding their personal dignity. Even if the patient themselves doesn't seem too shy or concerned about being exposed, their family members or bystanders might be uncomfortable on their behalf. And often the patient will appreciate your efforts to protect their privacy, even if they don't voice it. In practice, maintaining modesty means doing simple things like covering the patient with a sheet or blanket whenever possible, especially if you've had to remove some of their clothing to treat them. For example, if you need to cut a patient's shirt open to examine an injury or to apply EKG electrodes to their chest, explain to the patient what you're doing and why. You might say, I'm going to cut your shirt so I can get these pads on to check your heart, okay? Do what you must for medical care, but then cover them up as soon as you can. If the patient is female and you've exposed her chest for treatment, try to use a jacket or second towel to cover her quickly once the critical exam or treatment is done. Also, politely ask any unnecessary bystanders or curious onlookers to step back to give the patient privacy. If family members are present, you can station them in a way that preserves the patient's dignity. Cultural sensitivity is a big part of this. It's one aspect of overall cultural competence. Different cultures have different norms about modesty and gender interactions. For example, in some cultures, a woman might be very uncomfortable with a male responder seeing or touching her body, especially in private areas. She might hesitate to let you examine her injury because of those beliefs. Being aware of this, you can try to alleviate her concern by explaining each step and why it's necessary, and by making sure she's covered as much as possible throughout care. If a family member, like a husband or mother, is present, you might involve them to help shield the patient or communicate comfort. Another example, some patients wear religious garments or clothing that they prefer not to remove. Whenever possible, work around these respectfully and remove only what's absolutely necessary for treatment. You can say, I need to look at your abdomen for any injuries. I'll only lift your clothing enough to check and I'll cover you right back up. This kind of communication shows you respect their values while still doing what's needed medically. By protecting your patient's modesty and privacy, you show them and their loved ones that you care about their dignity. This goes a long way in building trust. A patient who feels respected is more likely to relax, cooperate, and have confidence in you as a professional. They understand that even though you might have to examine or treat them in sensitive ways, you're doing so with discretion and respect. That feeling of safety and respect is exactly what therapeutic communication aims to achieve. The patient feels cared for as a person, not just as a medical case. Effective communication with patients also means knowing how to ask the right questions during your assessment. In patient interviews, there are two main types of questions you can use: open-ended and closed-ended. Open-ended questions. These invite the patient to tell you something in their own words, allowing for a fuller response. They often begin with words like how or what, or phrases like tell me about. Open-ended questions are great for getting the story of what's going on and for checking a patient's mental status. For example, you might ask, can you describe what you're feeling right now? Or what were you doing when the pain started? The patient's answer will give you details and also let you gauge how well they can articulate their situation, which tells you about their level of alertness and orientation. If they can give a clear, coherent description, that's a good sign. If they have trouble explaining or only give very short answers despite prompting, that might indicate confusion, a lowered level of consciousness, or extreme anxiety. Open-ended questions also make the patient an active partner in the conversation, which can increase their comfort. Closed-ended questions ask for a specific and brief answer. They can often be answered with yes or no, with a single word, or a very short response. Closed-ended questions are useful when you need focused information or to confirm details. We also call these direct questions. Examples include, do you have any allergies? Are you feeling nauseous? Or, on a scale of 1 to 10, how bad is your pain? You use these to pin down precise information. In emergencies, closed questions can be crucial to get quick answers, like, have you taken any medications today? Or, is anyone else here also feeling sick or hurt? These targeted questions help you gather critical facts fast. They are especially helpful if a patient is not very forthcoming or if time is of the essence. Usually, you'll use a combination of both types of questions. A common approach is to start with one or two open-ended questions to let the patient explain things in their own words. Once you have an initial understanding of the situation, you follow up with targeted closed-ended questions to get the specific details you need. For instance, you might begin by asking, what made you call 911 today? And let them narrate the events and symptoms. Then you could ask a closed question like, do you have any chest pain right now? Based on what they told you, or to check for an important symptom that they didn't mention. Remember not to overdo closed questions to the point that the interview feels like an interrogation or a checklist. Give the patient time to tell their story in their own way. The open-ended questions build rapport and show that you're listening, while the closed-ended ones gather the specifics you need for your assessment. Balancing the two will make your patient interviews both thorough and patient friendly. You get the necessary information without making the patient feel rushed or sidelined. We will end the first half of this lecture here. Please join me on the next part for more therapeutic communication strategies.